Hello, this is Dr. Swapna Priya, consultant dermatologist, cosmetologist, trichologist from Cosmosure Clinic, HITEC City. Today I would like to discuss about one common topic where many people do come to us and being asking many times like, why do I get so many black spots on my body? Is there any health issues I'm facing with, or is it just a cosmetic problem, or should I be worrying about it? Can anything be done for that problem? So we will go ahead with this discussion on these lines today. To start with, the black dots can be of any size, can be of any appearance. To say, for example, the black dot can just be a plain black dot which is in the level of the skin, or sometimes which is elevated above the surface of the skin where you can feel the bump, or some tag like thing which is holding it onto the skin, or sometimes they are stuck on the skin which increases very rapidly. Sometimes these black spots can be even itchy. So what is the combination of your complaints is what is important. How rapidly are these developing? Are they being affected by the temperature changes, sun exposure, your lifestyle, your weight gain? These all matters to our discussion. So to start with, the most common problem is moles, the black dots like thing which are just happening, multiple black dots which are happening on the body which are darker in color, and when you see on the dermoscope they have a just normal appearance of pigment pattern without any excessive growth or any ulceration or any itching. Is nothing to be worried. See, always we have known from childhood birthmarks which can happen when we are born. But still the truth is the moles can increase in number and size even after we are born, and even in the middle or elderly age they can increase in number and size. But if any mole is increasing rapidly in size and it is causing itching, the appearance of the black color is not uniform. In one place it is darker, one place it is thicker, and one place it is lighter, and it is developing an ulceration or any asymmetry. These are all symptoms which we should be worried. Then that definitely it is a time you meet your physician or a dermatologist to examine this black spot to be should be really worried or not. They will take the call. Coming to the next aspect, where you have multiple seborrheic keratosis, where we have a stuck-on appearance of these black spots which vary in size from few millimeters to or sometimes even centimeters. They can happen in rapid numbers sometimes, or just as a part of routine thing. They can happen on the trunk, sometimes in the underarms, or sometimes on the back. Few people even develop even around the ankle areas. This is also just related to an aging pattern which we do not need to be worried. But any symptoms like how we have spoken for the previous complaints, rapidly increasing size, ulceration, itching, calls for an attention which you need to meet the physician. Very rarely, eruptive seborrheic keratosis is sometimes related to some underlying problem. Then you might need to be worried and concerned, which you need to go ahead with some scans. But this is very rare in Indian scenario. But usually, when it is related to foreigners who are of lighter skin type, these moles and seborrheic keratosis can be a troublesome thing for them. Then definitely they need a biopsy to evaluate if it is having any problem or not. Coming to the other type of black spots, where sometimes people develop secondary to other issues like underlying problems like a liver disease or a kidney disease, where they will have itching in those spots, have elevated bumps, sometimes oozing like thing can happen, or whitish scales can be seen. This can be sometimes secondary related to lichen planus, or sometimes any renal issues which leads to these sort of prurigo simplex or Kryl's disease. These are some problems which can be seen secondary to underlying systemic problems. Another problem which is very commonly seen in few people is skin tags. These skin tags are elevated above the skin surface, or sometimes they can be still of the normal skin color, though they are not always black. But commonly they can be either elevated, having skin color, or sometimes black color. On face, we see many people having small dotted appearance. When they touch the skin, they can feel the bump, but they do not have any problem in them except for the cosmetic reason in terms of appearance. So these are very asymptomatic. They do not go off for the creams. You might need to be getting them removed if you are not liking them. But otherwise, whether you remove or not doesn't matter to prevent the newer moles or these bumps to not to come. And they can be removed without any sequelae like black marks or any scars on your skin. Coming to the last issue, which is freckles. These are called sunspots more commonly. They are more commonly seen on the face, particularly in the sun exposed areas, and have the seasonal variation in the darkening of these spots. During summers, they become very dark, and during milder climate like winters and rainy, they become lighter. So it calls for an attention that they have to take more skincare in terms of using sunscreens very sincerely and proper physical covering when they are exposed to sun for longer hours. And if they are not improving with just the creams, definitely they can be handled by treatments like Q-switch laser and can give a good clear skin on your face. So these are the issues of the black marks which are commonly seen on many people's skin and which can be easily handled. Another type of black marks which we see on people is on their hands and legs, particularly in the exposed areas on the extensor surface of the hands and legs. This is very commonly seen secondary to scrubbing of their hands. Many people have a habit of using loaves or some scrubs monthly or weekly ones, or sometimes a few people use it every day. So this sort of pigmentation is rippled pattern or net-like pigmentation which is commonly seen, which is called amyloidosis. The first step in this treatment is to prevent the friction or excessive rubbing of your skin and then using a sunscreen and a skin lightening agent. Few people even have itching associated with these black marks. In that case, they might need a very mildest or low strength of their steroid lotions or antihistamines to prevent the itching problems. So these are the other common problems which we commonly see in the people's skin, which can be handled by identifying what the right problem is and then the right solution can be offered. Thank you.